Okay, hello everybody. This is the continuation of the neuro unit, whereby we will start with dysfunctions of the eye and vision. Um, there is a picture there in the initial slide showing the parts of the eye. If you need to refresh yourself on the parts of the eye, take a look at that. And then the next section being just simply definitions. Nothing difficult there, but blepharitis being inflammation of the eyelids happens oftentimes with a staph infection. And the next two, a hordeolum or a sty, very difficult to distinguish between a hordeolum and a chalazion. They're two different. They're blockages or infections of either sebaceous glands or the oil-secreting meibomian glands, so those are. Like I said, they're very difficult to distinguish, but so we call them all styes, even though technically not exactly correct. Keratitis being infection of the cornea, a more rare condition. Conjunctivitis, either a viral conjunctivitis, which is self-limiting due to an adenovirus, and also contagious, but usually doesn't produce as much. Pus just produces redness and can produce slight discomfort or photosensitivity. The big one is the acute bacterial conjunctivitis. Again, that is usually staph infection, though could be a strep or other forms, other bacteria that are leading to the infection. Very contagious, painful, and a real drag because it spreads and can be. If anybody was watching the Olympics, Bob Costas had a bacterial infection of the eyes, and he was out for a few days. FYI, a naturopathic treatment that you may or may not want to consider. Urine from one's own self, not anybody else. A drop or two of one's own urine in the eye, very effective for the treatment of pink eye. I've done it before. It works when you're miserable and you don't have anything else. It's worth a try. It's just salt water, urea, etc. Other forms of conjunctivitis, allergic conjunctivitis. Anybody who has allergies can tell you what the experience is. I remember driving through a wheat field on a mini bike when I was a kid, and my eyes just completely swelled up, and or sometimes being in a cornfield could do the same thing, just because of the pollen, and the itching is horrendous, self-limiting, and so not a big deal. The other kind of conjunctivitis that we treat preventatively for by putting drops of silver nitrate in the eye, and they might use other drops as well in a baby's eye when they're born to prevent chlamydial infection. It is the leading cause of blindness, preventable blindness, and mostly this is third world countries. But that's one of the reasons why we do that. Okay, in terms of alterations of ocular movements, strabismus. So strabismus is the deviation of one or both eyes. Entropia, meaning the eye moves inward, and extropia, I can't do it, means the eye moves laterally, deviates laterally. And the issue there being that there's a failure of the fusion of the visual fields, so the eyes don't fix together as they should, and so there is a distortion of the visual field leading to diplopia or double vision. In terms of causes, neuromuscular disorders, cerebral, any kind of head injury, cerebral diseases can lead to that. And thyroid conditions can also cause that, hyperthyroid conditions. which we'll talk about when we get to the hormonal issues. Nystagmus is another, it's an involuntary, usually bilateral, though it can be unilateral, rhythmic movement. It's sort of like a water sprinkler where you have a smooth movement in one direction and then a jerk movement in the other direction. So smooth and then jerk. Rhythmic, and this is usually caused by and by the way, so that you can have a physiologic or voluntary. Some people can do it on purpose. Maybe some of you can, or there's a pathological condition whereby there is damage to either the semicircular canals in the inner ear or something in the vestibular system. And then possibly damage in the cerebellum, leading to this condition. As I mentioned, damage to the inner ear, the little what they call otoliths, or the little crystals in the inner ear, can lead to this nystagmus condition. It's mostly used as an indicator of some sort of damage. That is a sign of some sort of a disease that one would want to pay attention to. Let's see, paralysis of muscles, so trauma, myasthenia gravis, diabetes, all can lead to damage to specific muscles, and when you have a damage, you'll have a weakness, and the eye will pull to one direction or the other, or ptosis, meaning eyelid droop, or double vision, or a loss of vision because the eyelid can kind of sag down into the visual field. Old age does that too. Or a weakness in the muscle such that the eye movement isn't optimal. Let's see here. Where are we? Regarding that's amblyopia. Sorry, I'm looking at two different sets of notes, so I'm gonna be a little bit off here. Myasthenia gravis on there. We've talked about myasthenia gravis quite a bit. I think we've mentioned it in almost every. You need to know this one by now. In almost every chapter, but these are the autoantibodies that block the acetylcholine, and therefore the neuromuscular junction is not getting neurotransmission, and ptosis of the eyes. Remember, we talked about it in upper body weakness, etc. But we're talking about it here because it can cause drooping of the eyelids. All right, amblyopia. So amblyopia, also known as lazy eye, which is kind of inaccurate. It's actually lazy brain. What happens is the brain actually shuts down the pathway from stimuli coming into the eye, through the optic nerve into the brain, and the brain oftentimes this is a result of strabismus, or when there is a double vision caused by any number of things. The brain says, I don't like this, and it shuts down one side, so you get problems, visual problems secondary to that. Let's see, anything else I wanted to say about that? Oh, atropine. Remember, we talked about belladonna atropa. Atropine drops, which cause the pupillary dilation, can be used for that. Usually due to deprivation of vision, as I talked about with strabismus. Cataracts can also stimulate amblyopia. Scotoma, excuse me. So scotoma is a central field graying, if you will. It's a blindness or a loss of vision in the uh, uh, central field of vision. Um, let's see. Common causes, macular disease. So I'll talk a little bit about that in just a few minutes. Pernicious anemia can, because of neuropathy, can cause a scotoma. Scintillating scotoma, when you have the wavy kind of wavy lines in a central field, happens oftentimes accompanying a migraine headache. Although all types of scotomas can happen in a migraine, people can actually have what's called an ocular migraine, where they get this scotoma without actually having head pain. Demyelinating diseases obviously would cause a scotoma. And then keep in mind that we all have a physiologic scotoma because it's our blind spot. We all have a blind spot where the optic nerve comes in, and therefore you have a loss of visual cells in that area. And because we have a blind spot, the blind spot is different in each place, our brain doesn't, our brain compensates, or our eyes compensate. In this eye, I have, it's not, in other words, it's not an overlapping loss. It is two separate areas, and therefore our brain can, each eye can detect what's happening in that area. Our brain overrides that and fills in that gap, if you will. Let's see, cataracts. Cataracts, greater than 50% of people age 65 or older will have developed cataracts, usually due to aging. Clouding, you get breakdown of the protein, and breakdown of the protein causing that cloudiness to occur in the lens of the eye. Trauma can cause it, congenital issues. So actually children can be born with or develop shortly thereafter birth, can develop cataracts. Metabolic issues, so diabetes, we'll talk a little bit about this, but as a result of the sugar, the glycation or glycolation happening, the sugar molecules bind and render the proteins dysfunctional, and they denature, and that causes cloudiness. Medications, steroids, so steroid medications, and people with Cushing's disease have a predisposure to the development of cataracts. Cigarette smoking, alcohol, UV light, wear those sunglasses, and I often don't. But excess cigarette use, excess alcohol use leads to the development of cataracts. That's all I want to say there. Yeah. Okay, alterations in visual acuity. So the ability to see very well. So papilledema. Papilledema is inflammation of the optic nerve and the optic cup, where the optic nerve comes in, and that's often at times a sign of, and that's what we're looking for. We look in the back of the eye if we're concerned about an increased intracranial pressure as a result of that increased pressure in the brain. Pressure builds in the optic nerve and forces the optic nerve forward, and can obstruct venous return, and therefore lead to damage to the visual cells. Again, it's usually secondary condition. It's asymptomatic, but also can be accompanied by a headache. Again, probably not due as much to the eyes as to the increased intracranial pressure. Okay, dark adaptation. So don't spend a lot of time with this. However, understanding the parts of the eye. So we have in the outer portion of the retina, we have the rods, and in the central vision, central retina, we have the cones. The rods and the cones take longer to adapt to light. In the adaptation process, opsin binds with retinol. So remember, that's why retinol is vitamin A, and that's why we eat our carrots. And Mom told us to eat our carrots for our eyes because of the retinol produced by beta carotene. So anyway, the rods take longer to adapt. They bind and they change the structure of the protein. The retinol binds to the opsin, creates rhodopsin, and that changes the structure of the protein and causes a light sensation. And rods take about 30 minutes to make that adaptation. Cones take only about 10 minutes to make that adaptation. And failure of this can result in something called nyctalopia, 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 or night blindness. So night blindness is a failure of the cells to adapt to the changes in the light, or to the lack of light, if you will. The rods especially fail to respond to any light, and therefore, because of the location of the rods and the cones, we end up with a decrease in our peripheral vision because that's where the rods are. Dark adaptation. All right, hang in there with me. We've got a little ways to go here, but we'll move along as quickly as we can. Okay. So glaucoma. Glaucoma is it? Know this. Glaucoma, increased intraocular pressure, increase in pressure in the aqueous humor, and that increase in pressure causes damage to the retinal ganglion cells and risk of blindness. Two different types: the open angle and the closed angle. Open angle happens a little bit more slowly. The angle that we're referring to is the angle between the iris and the cornea, which allows for the fluid to redistribute. And so with that, you get a blockage of the fluid and a buildup behind the eye. Excuse me. In the chamber of the eye behind the lens, and that can decrease. Again, can cause those damage to those cells. So. So closed angle, there's open angle and closed angle. Open angle, a little bit more of a long-term issue, long-term, it's an aging issue. Closed angle is, again, a medical emergency because causes extreme fast buildup of pressure and high risk of damage. Generally, the loss is a central visual loss, I believe. That may or may not be true. No, I think my notes are referring there to macular degeneration. So okay, so let's move on to macular degeneration. So macular degeneration is loss of vision to the light-sensing cells in the macula, and this happens. Generally, this is an age-related issue because of damage, long-term damage. Again, because of UV light, hypertension, high cholesterol, coronary artery disease causing damage to the blood vessels. What happens is you can develop blood vessels behind the increase of blood vessels to try to get more blood flow behind the retina, and uh, and cause retinal detachment. So two different types. The atrophic type is where you get that the drusen. Drusen is that yellow pigment, those age spots. If you, most of you are probably not old enough, but if you look at your skin, you can see those yellow brown spots that get deposited in your skin. Well, guess what? They get deposited in our lungs. They get deposited in our eyes. They get deposited in liver, causing that yellow discoloration. It's an aging condition of degeneration of proteins. And it happens in the eyes, and that's what leads to damage called atrophic or dry macular degeneration. Let's see. So happens especially with women, as I mentioned earlier, smoking, family history, etc. Oh, the neovascular, the wet form of macular degeneration. Is where you get scarring in the retina and or abnormal increase in the blood vessels. As I said, they can grow into the aqueous humor and cause problems that way. But the atrophic or dry age-related macular degeneration is the most common form. Alterations in accommodation. So as we age, that lens loses its elasticity, as other parts of the body happen as well. But you get a loss of elasticity of that lens, and so that lens can't accommodate as quickly. So we're if we look at a distance and we look close up, our eyes can't change, our lens can't change shape nearly as fast as we used to, and therefore we have a decrease in our ability to focus on near objects, and that's why some of us have to look like this, because we're looking at the bottom portion, because we have to have bifocals or progressive lenses to accommodate for that. So the manifestations of presbyopia. Presbyopia is this inability to focus on near objects. Double vision can happen, blurry vision, sometimes headache. Happens early 40s, happens almost overnight. It's incredible how fast it happens. Okay, a little bit more here. Retinopathy. So retinopathy is caused by an inflammatory condition whereby there's vascular remodeling and therefore risk of decreased oxygenation to the retinal nerve cells and therefore decrease in vision. Usually caused by diabetes. Hypertension is a big contributor, but also UV exposure over time, so aging predisposes to a retinopathy. So all people with type 1 diabetes and about 60% of people with type 2 diabetes will develop diabetic retinopathy within 20 years. Obviously, this is a major concern and a major cause of blindness or decreased vision. Again, the retinal capillaries have a decrease in red blood cell transport. Okay, so proliferative and non-proliferative types. The non-proliferative types are characterized by what's called a cotton wool spot. These are little infarcts of the retinal nerve fibers secondary to the loss of oxygen. So you get infarction of some of the nerve fibers and little hemorrhages in the retina. So therefore, you have decrease in the visual acuity. The proliferative type is also called neovascular, again, where you get this abnormal blood cell growth. In response to low oxygenation, your body produces excess um, uh, or excess blood vessel growth, um, uh, neogenesis of the vascular tissue. And so it actually grows into the vitreous humor and causes visual disturbances. Retinal edema, possibly detachment. Okay, alterations we talked about alterations and accommodation already, changes in the lenses of the eyes as you get older. Oh, myopia. So myopia is nearsightedness. So if you look at the next slide, I think it's pretty. It's a good picture. So in myopia, sorry, the light rays will come in, and your lens acts as a prism, and the light rays refract and bend, and the focal point comes just to the just anterior or in front of the retina, of the screen, if you will. So it'd be like the focal point is in front of the screen, and therefore there's a distortion of vision. You can't see things close up. The opposite happens in hyperopia or farsightedness, where the light rays would the focal point would be behind the eye. Obviously, it doesn't travel behind the eye, but that would be a theoretical focusing of the eye. So the bottom line is it's not focused on the screen or the retina, and therefore a distortion of vision or a lack of vision close up. So you can see farsighted only. Astigmatism then is where there's a curvature of the lens. Curvature of the cornea, the corneal lens, I guess, and therefore you have a bending of the light rays, and the light rays don't converge in one location; they converge in many locations, and therefore issues with visual acuity. Okay, color blindness. Oh, age-related yellowing. So again, that's part of that whole aging of the proteins causing a yellow discoloration. And with yellow, if you ever put a yellow lens, like a yellow sunglass, that causes difficulty in discriminating. It filters out blue light, and therefore difficulty in discriminating between different colors, as does color blindness. Let's see if there's anything else I wanted to say about color blindness. I don't think so. Okay, so that's the end of vision. Stay tuned. We'll talk about hearing in just a moment. Thank you.